Respiratory tract infections, everything you need to know. What are respiratory tract infections? Respiratory tract infections (TRIS) are infections that affect the parts of your body involved in breathing, such as your sinuses, throat, airways, or lungs. They can be caused by a variety of microorganisms, including viruses, bacteria, and fungi. What are the symptoms of respiratory tract infections? The symptoms of TRIS vary depending on the type of infection and the severity of the infection. Common symptoms include runny nose, sore throat, cough, fever, shortness of breath, wheezing, fatigue, muscle aches. How are respiratory tract infections spread? TRIS can be spread through contact with respiratory droplets from an infected person. These droplets can be released into the air when an infected person coughs, sneezes, or talks. You can also become infected by touching a surface that has been contaminated with respiratory droplets and then touching your eyes, nose, or mouth. How can I prevent respiratory tract infections? There are a number of things you can do to prevent TRIS, including wash your hands frequently with soap and water. Use an alcohol-based hand sanitizer. Avoid close contact with people who are sick. Cover your mouth and nose with a tissue when you cough or sneeze. Dispose of used tissues immediately. Get vaccinated against common respiratory viruses, such as the flu. What are the treatments for respiratory tract infections? The treatment for TRIS depends on the type of infection and the severity of the infection. Most TRIS are mild and will go away on their own within a few weeks. However, some TRIS may require treatment with antibiotics or antiviral medications. When should I see a doctor? You should see a doctor if you have any of the following symptoms: severe fever, shortness of breath, chest pain, wheezing, bluish lips or fingernails, confusion, dehydration. What are the complications of respiratory tract infections? In some cases, TRIS can lead to serious complications, such as pneumonia, bronchitis, and sinusitis. These complications can be life-threatening, especially in young children, older adults, and people with underlying health conditions. How can I manage my respiratory tract infection at home? There are a number of things you can do to manage your RT at home, including get plenty of rest, drink plenty of fluids, take over-the-counter medications to relieve your symptoms, use a humidifier or take a hot shower to help relieve congestion, gargle with salt water to help relieve a sore throat, suck on lozenges or hard candy to help relieve a cough. Respiratory tract infections are common, but there are a number of things you can do to prevent them and manage them at home. If you have any concerns about your RT, be sure to see a doctor.